Buonasera a tutti, io sono Alberto Mingardi, questo è il nostro primo appuntamento con Liberi Oltreconfine, una rubrica nella quale andremo a scoprire un po' come se la cavano altre parti del mondo, qual è lo stato della libertà individuale, delle politiche pubbliche in altri paesi, parlandone con degli interlocutori, con degli amici in realtà che ci racconteranno un po' alcune cose interessanti o al contrario preoccupanti che stanno avvenendo nei rispettivi paesi. Per questo nostro primo incontro parliamo di Madrid. Come alcuni di voi sapranno, ci sono state le elezioni per la Comunità di Madrid. Queste elezioni sono state vinte dal Partito Popolare in modo schiacciante, con una candidata, Isabel Díaz Ayuso, che ha brandito la parola libertà come uno slogan e che soprattutto è stata premiata per il suo responso, per il modo nel quale ha reagito alla pandemia, cercando di mantenere quanto più possibile aperte le attività economiche e di mantenere insomma anche, diciamo così, le condizioni di vita delle persone il più normale possibile, soprattutto a partire dalla seconda ondata. Ne parliamo con Javier Fernández-Lasquetty. Javier è oggi ministro della Comunità delle Finanze, ancora ad interim in questo periodo, lo è stato per gli scorsi 2 anni e il nuovo governo si formerà nel mese di giugno. In precedenza è stato vice rettore dell'Università Francisco Marroquín in Guatemala, un posto molto particolare, l'unica università apertamente e orgogliosamente liberale del mondo. Prima era stato direttore generale della Fondazione FAES e aveva già collaborato al governo della Comunità di Madrid con Esperanza Aguirre all'epoca. Quindi una vita tra gli studi e la politica, la politica anche di amministrazione. Per me è un grande piacere vederlo almeno così, visto che è troppo tempo che non ci vediamo. E adesso chiacchiereremo un po' in inglese. Javier, it's a great pleasure for me to see you, albeit only on Zoom.
Very, very happy to see you, Alberto Mingardi, and I'm very proud to be here at this important YouTube channel and speaking about freedom and the results of freedom. So very, very happy, especially having that I am a grandchild of Italian, of an Italian coming to Spain in the past.
Well, let's start with the election. So if I'm right, in the last election, Isabel Díaz Ayuso won something close to 45% of the vote, taking 65 seats in Madrid's assembly. The assembly is 136 seats, which is, you know, really, it's basically twice as much as it happened in 2019, when the Partito Popular got something like 22-23%, if I'm right. That's an interesting signal, first of all, to me politically, because, of course, in 2019, the two-party system in Spain was pretty much under discussion, right? And so you got the emergence of new parties on the center, Ciudadanos, on the right, Vox on the left of PSOE, with Podemos. Many people said that somehow this election in Madrid consolidates the bipolar system. So, you know, the Partito Popular on the one hand and PSOE on the other are somehow consolidating their roles. Do you agree with that? Was it also a change politically speaking?
Well, I think in the times of the hard crisis of the previous decade and the beginning of this decade, there was a an arousing of new parties all across Europe and all across the world, no? With that mix of Adanism, with them everything begins and nothing will be the same, no? and nothing will be so much difficult for people and for the distance between the politicians and the real people. But as much as time goes by, people can see that some of these parties, new parties, in this case in the center and in the far left, well, are much more politicians than ever, much more tactics than ever, and with them, I think there's no more stability, and there's no more possibility of to take, for instance, the serious reforms which a country like mine, Spain will need, no? So in these elections, they have passed the test and they failed. I have to say, Ciudadanos, the center party, literally disappeared. In my opinion, this is the reward that receive everyone in politics that decide to have no opinion about nothing. If you don't take position for or against taxes, for or against open economy in the middle of the pandemic, or for or against, if you want to be not to decide, I prefer not to be seen as for or against something. The decision of the people is of course to have no any interest on them. No? But I think in these elections there was another important issue that I will like to remark with you, Alberto. Isabel Díaz Ayuso, the candidate of a popular party here in Madrid and the current president of the region, is a liberal woman, and for many time, but in her 2 years of private term, the idea of freedom has been in the foundations of all her decisions. No? And I think for we as liberals to speak about freedom now, when a large amount of population is confined at home, forbidden to be or to develop their normal lives, forbidden to work, to speak to them about freedom sounds completely different than to speak about freedom in, we can say, normal times. No? And I think that this Madrid result shows a real opportunity for liberal options in politics and for liberal policies in terms of gaining popularity and the favor of the public. And I think that could be, if we take advantage of this, that could be a turning point, very important.
Well, I do certainly hope that. But I'd like to ask you to describe a bit better the sort of COVID response you went for in Madrid. Because on the one hand, clearly, activities remained open. In April, I do remember that I've browsed the web and I've seen that in the opera theater, they were giving Siegfried, which means 5 hours opera. That's a long
for Wagner's lovers. That it's not my case.
I'm happily one of those, but still,
I rather prefer Norma. That was the following Norma Bellini in the following representations.
So, activities stayed open, but I think you also implemented fast tests massively because, you wanted to control the spread of contagion, but you wanted to do that, if I understand it right, on a more localized level, basically keeping the outbreaks as small as possible. And I do also think that you set some general rules for activities in order to stay open. So I'll be grateful if you can just describe the set of decisions that were taken so that people in Italy may have a better view of what happened.
Yes, we had or we have two different, very different moments in this more than 1 year. In the period between March 2020 and August, September 2020 was the central government. We had the power to make decisions, and the regions were under the control of central government, socialist and communist central government, that decided a lockdown, total lockdown and total confinement model. After that, from September to right now, the majority of decisions are in the hands of the autonomous regions in Spain, and each one of them has decided different strategies, and Madrid has decided clearly an open economy, an open society strategy in order to contain the virus and at the same time to maintain the activity. So we have the chance to compare and to have two different models. No? And in the first moment, I have to say, in my opinion, and speaking generally, I think that mass and general confinements and lockdowns, I think, in my opinion, is the craziest thing mankind has ever done. By the way, pandemic has been an excuse, clearly an excuse for some governments, for instance, Spanish government, has been an excuse to impose some kind of authoritarianism. And I have to say, in this first phase of Spanish evolution during the pandemic, Spain was the most restrictive and lockdown, and therefore the most authoritarian country in the world, and was a complete disaster. We have the disaster both in terms of number of victims of the disease and for the country's economy. In the first phase or first wave, Spain was the European country with the highest excess mortality and the decline, the highest decline in the GDP within the Eurozone, 11% of decline of GDP in 2020.
We know something about that.
Yeah. So that is to show how much confinements or lockdowns doesn't mean people having excellent health conditions. No. You can destroy both two things. No? And creating this kind of atmosphere of fear, no? that it's very useful for authoritarians. No? Fear has been used clearly in Spain to pit citizens of different countries or regions against each other, neighbors against neighbors, to demonize leisure activities, hotels, restaurants, nightlife, and entire generations. No, the young, the young are guilty. No, so I think that it's a real problem. So. Faced with this, the Madrid government opted to prioritize and make freedom the economy and the health of its citizens compatible with a series of decisions that have borne excellent fruit and I think with very good terms. That needed courage, I have to say, and I see the portrait of Winston Churchill behind you, and I don't say, of course, that it's in the same level of importance and admiration. But Isabel Díaz Ayuso took a very courageous decision in the end of the month of September and the beginning of October. That it's at that moment in Madrid was rising the number of contagions in the second wave, and we received the regional government an incredible pressure in order to a new complete lockdown of Madrid. A real pressure coming from the national government, from the socialist government, a real pressure coming from the media, most of the media, not, a very strong pressure coming from our allied within the regional government, that it's, I have to say, a little bit complicated. And I have to say also a pressure coming from the professionals of public health. For many of them, the precaution principle is an absolute. No, what do you have to do? Confine people. How long? Forever? No. And we decided, and especially Isabel Díaz Ayuso decided, to come from a collectivized vision, we can say, of the disease, as if all of the population was a mass. Among them, probably there are people infected or contagion. From this collectivized vision to a individualized vision, personalized. Let's go to look who are infected, who is in the disease, and to have a plan for them, and all of the rest can go for the streets, can open their business, can work. And in this strategy, the fast test, the antigen test, were absolutely key. They identified positive individuals without delay, screening asymptomatic population, speeding up isolation, and cutting the chains of virus transmission. The speed, the simplicity, the low cost. I have to say, the fast tests are €4. No? In contrast with the disadvantages of PCR testing, we make a lot of PCR testing, but within the hospital environment, etc. But antigen test, fast tests help to quickly detect the infectious individuals and ensure for them rapid isolation and the treatment they need, and at a very affordable price, and with the possibility of frequent retesting. And so we made the public healthcare system has made so far more than 5 million fast tests to the population. And I have to say, private companies in Madrid probably have made much more tests to their workers. That it's wonderful, but that it's always under the suspicion of the left. No, that they see as a inequality that private companies test their workers. I don't understand why.
Actually, it's also for the worker safety.
Yes, exactly. And if companies are making tests, that's great because it's people that is contagious individuals that are not in the stream of the people flowing by the street. No, for instance, we wanted and we fought to obtain permission, national permission, for the pharmacies to make fast tests. That it's completely normal and logical, and we have to fight for 2 months against the national government in order to obtain finally the permission for pharmacists to test people. And of course, they said, but only in the case that a physician of the public healthcare system prescribe or this test. I don't understand why, because they create a shortage of a product that it's not in any shortage. The test, you have millions of tests at your disposal in the market at an unaffordable price. No? But that was the testing the testing strategy, and also the sewage water testing strategy that was also very useful. We developed a system of more than 280 sampling points all across the sewage network. The sewage water every day, and for after 8 months or 9 months doing that, it's completely clear that you see in the sewage water what will be in the healthcare system, in the hospitals, three days later. So it works as an advantage indicator of the evolution of the disease.
I'm sorry, I was muted. It happens on Zoom all the time. And so you could basically track, the way in which the virus was moving from one area to another. And you did have partial lockdowns, right, of some neighborhoods.
Yes, partial lockdowns of neighborhoods that were to lock down restrictions to movement, not lockdown in small neighborhoods with high rates of contagions. We established these restrictions of movement that actually were not very observed, I have to say. People enter and exit from these areas, but has been and are right now very useful as, if you want, a warning alert for people in your area, in your neighborhood. There are many people, more than, for instance, 500 in the rate of infection in 14 days. So you have to be careful. Bars are open, restaurants are open. You can walk the street, but you have to be careful. And I think that was more useful than a total lockdown. That looking what is happening in other Spanish regions and in other European city capitals, I have to say that total lockdowns have shown that it's not an intelligent strategy in order to contain the virus.
Well, you were mentioning your difficulties in allowing pharmacists to provide tests. One issue which is always of interest to us in Italy is, what are the powers of the Spanish autonomies? What you could or couldn't do in this regard as with others. If I understand correctly, for example, you do have also nuances and differences really in the provision of healthcare. And Madrid is different than other regions also on that front. How do you value, how do you judge the powers you had vis-a-vis the power of the central government in fighting the pandemic? Were there, any power really you felt you needed on the ground in local government that you don't have at your disposal?
Well, I have to say that I don't think at all that the Spanish distribution of power and the very complex system we have, I can put it as a model for nobody, for anybody. It's complicated, it's difficult, it works with difficulties, but I have to say that for the fight against the pandemics has shown a little more elasticity, a little more ability to be very, very close to the ground, no? or to the grassroots. No? Everything in this pandemic shows us once again how much the top-down system are not able to manage complexity, to manage emergency, for instance. And I think many of the failures in many countries, Spain within them, comes from the arrogant idea of the completely the central engineering organizer that knows everything about everything. Now, you don't know so much, no? In Spain, the region, the healthcare system is decentralized, is in the hands, the power of the of the autonomous regions. I have to say the rules, the rules are in national laws, so is the national power who decide who is treated, everyone, at which price, any price, and the way the hospitals and primary care facilities are managed are more or less decided at national level. So, but the regions, we have the power to manage the system, so to decide if we do this job with 20 hospitals or 36 hospitals like this in Madrid, with 10,000 or 15,000 physicians like we in Madrid. So we were able to develop some, I think, interesting ideas and useful ideas. In the first wave of the pandemic, Madrid was the first region in Spain to create in less than 24 hours a field hospital within the main exhibition center, the fair facility that is IFEMA, the Fair of Madrid, and we created this field hospital in 24 hours in the moment, more or less March 20th, when we saw that the hospitals were in the verge of a total collapse of the absorption of people. No? So this field hospital was able to attend 4,000 patients with very, very, very good results. And so we decided to take lessons from this experience, and in the meantime, during the first and the second wave, we built a pandemic hospital. Is the Hospital Enfermera Isabel Díaz. I can't understand why, but the most hated hospital by the left. That they say that a public hospital devoted to pandemics is a crime against the humanity. I don't understand why, but we built this new hospital in just 100 days with a capacity of more than 1,000 hospital beds, organized modularly and around nursing control. It's like a field hospital, but established, and so a little bit more.
Altogether, how much did you increase the capacity of hospital beds between these hospitals and the field hospitals, and I suppose more beds that were added for emergency care units?
Well, in the moment of the stronger pressure that was in the first wave, I can say in the month of March and April 2020, we doubled the bed hospitals capacity, and we tripled the ICU capacity. And I have to say, this new pandemic hospital that we have since the month of November, this pandemic hospital, that it's a very high roof facilities and very well prepared, has attended by the moment so far more than 4,000 patients, and it has allowed to the rest of the public and private hospitals to continue with their normal life without many COVID patients. The majority of COVID patients goes to this new facility, this new pandemic hospital. So the normal hospitals, public and private hospitals, continue with oncologist surgeon, with the normal healthcare activity, and that created a very good atmosphere in terms of the ability of the healthcare system, both public and private, to continue attending people with their normal conditions.
Well, as you know, healthcare is regionalized in Italy too, and somehow the pandemic was a tragedy for the very idea of having different healthcare system within a country, because Lombardy, which is really the single region which had a different healthcare system, at least for a while. Now the rules changed a bit, but still, it's the region where private provision of healthcare is it's not predominant, but it's clearly stronger. Lombardy was very seriously hit by the pandemic at the beginning, and the system didn't react well, not so much in the hospitals where you do have a certain amount of, I won't say necessarily competition, but private and public suppliers. But when it comes to the public healthcare system and all the local general practitioners and so to say the backbone of the healthcare system that is clearly vital when it comes to coping with a threat like COVID-19. And of course, Lombardy started very slow in the vaccine rollout. Now it got much better, but also for that reason, I'm sorry, it was at the center of somehow endless accusation of the Lombard model has failed and that sort of stuff.
Regarding public and private suppliers, if you want, I can say a word about our Madrid experience. We have a very good experience in the cooperation between private and public suppliers in the hospital branch, in the hospital level. Not so much in the primary care, I have to say. In the primary care has been mostly the public system who take the patients. But from the very beginning, from the very first week of the rise of the pandemic in March 2020, voluntarily private hospitals here in Madrid established an alliance with the public system. And during all the pandemic, especially in the first wave, of course, it was much more tough, but all across these waves of pandemic of COVID-19, private and public hospitals have worked in a unique, in a single network, and that was really very useful, and private sector is really happy to be part of this. And of course, we paid the services of the public hospitals with more than 40 million euros for their services in the first wave. And of course, private hospitals continue attending their private patients of COVID-19. Of course, we're not any difficulty of doing that. But I think that is here in Spain, there's a continuous struggle against, or fight from the left against, the single idea of having any kind of private supply of public healthcare within the public healthcare system. They say no, the private gains are incompatible with the idea of public healthcare. Bullshit. In the worst moment, public and private hospital could work absolutely in a single network, and for the very best care for every people, without regarding if they come as a private or public patient.
Well, thank you very much. I think, as a matter of fact, the same happened here, but somehow the blame for the, so to say, public health care, not in the sense of provision of care in hospital, but the organization of the healthcare network and really hygiene, so to say, what once was called hygiene in terms of public policy, was shifted to a system, which is the Lombard one, where private hospitals are very important. And actually, they did very good thing also in the pandemic. I think about hospitals in Bergamo that was very severely hit in the first wave, but even in Milan, private hospital did plenty of good work. I'm taking a lot of your time, but let me ask you two more questions. One is, I remember the last time we saw each other, you pointed out to me that during the first wave, you've actually seen that leisure activity, as you said before, were more important to the Madrid's economy than basically what's typically considered, what's typically maintained. So I would like to ask you, what did you do in order to keep restaurants, theaters, and so on open? I suppose you went for some general rules that everybody had to follow. Also, how much were they given subsidies in these circumstances? And how much of that came out of local government? And how did you finance all of that?
Okay, well, in Madrid, before COVID-19, tourism accounts for 7% of Madrid's GDP and employs 400,000 people. But we realized after the lockdown, the total lockdown of the first wave, that the real impact of that lockdown was much greater than expected, because of course, the chain of value of the hospitality sector and the hotels, etc. For instance, I remember one day one pharmacist in Spain, to have a pharmacy is more or less to have a very sure business for life. Yeah, but I remember very well one day in the month of July that a woman, a pharmacist woman, told me, I have lost 80% of my business because she has the pharmacy in the downtown, in the ancient neighborhood of Madrid de los Austrias. So she lost most of her business figures. So Madrid is a region with a very important flow of people coming for congresses and conferences, but also attracts many visitors for a cultural and gastronomic offer. No? Important museums, musicals, opera house, and that is really
bullfights.
Bullfights that we both love bullfight, and that it's very important for us. So the decision in the third wave from September 2020 to this moment was not to never again a lockdown, never again a lockdown, to appeal to the individual responsibility of population and the bars and restaurant owners and managers, establishing some rules in terms of distance between tables and people, and some and a limit for opening hours that was established until 11 p.m. Until the last week, and now has raised to noon. To midnight, 12 a.m. I have to say that in Spanish terms, 11 p.m. is
early afternoon.
Soon is really a little bit soon, no? And for instance, the hospitality sector praised for this one supplementary hour from 11 to 12 because they say is the hour of the drinkings after dining, no? So, of course, we have a weather that allows to have terraces and tables in the street for many months. But I have to say, for the first time in our lives, all of we here in Madrid, we have getting the custom we have of being outdoors in the month of January, that we never previously did that. No, but outdoors, distance, and social individual responsibility in one hand, and in the other hand, fast test and, of course, the vaccination are, in my opinion, the key for a, we can say, freedom, or freedom, the less constraints to freedom model that we can set up in a country or region.
Here comes my last question. You know, Madrid was distinctively a different model than the rest of Spain, but really than the rest of Europe. And yet, we didn't talk a lot about Madrid before the election. It looks like that to, good number of international journalists, Ayuso's winning, and with this number, came as a surprise. Now you do have growing international interest in what you did. Of course, with some people opposing it. I read an editorial in El País last night that said, this is a dangerous model for the Partido Popular. Should be, basically closer to the left, to the Spanish left in its core policies, but that is to be expected in El País, really. At the very same time, we've seen an article in the FT on Ayuso. So the rest of Europe is little by little acknowledging that you did something different than most of us. How do you see this happening? What sort of questions are you asked, like the one I just asked you? And how important is for Madrid as a city and as a model to be recognized as such? I have a few Spanish friends. One is a very dear common friend who never votes. Yeah. And I was very surprised to see that she went to vote, and she campaigned. We're talking about Professor Maria Blanco, who's a dear friend. So she campaigned for Ayuso in the sense of writing and being active in social media. And she's clearly not, a woman of the right in many ways. So how do you see this interest developing and perhaps changing the perception of Madrid and of PP politically?
I think that Madrid is attracting the attention and some kind of interest in what we have done because of the results that we achieved so far, and also because the fact that having an election, an unexpected election, an early election with very tough moments. This election has been a very, very, very tough fight between a left with the idea of top-down, more or less authoritarian models of dealing with the COVID-19, and our candidate Isabel Díaz Ayuso with the idea and the word freedom, just one word, freedom, and of course the policies that comes from the idea of freedom. So, in my opinion, this could be a very interesting or something that could be important in order to realize two important things. First one, also in times of pandemics or emergencies, freedom works. And freedom works better than authoritarian or lockdown models. And the second idea is in terms of politics or influence or the world of ideas or policy making, that now we have an opportunity window for freedom-based policies here in Europe, because people is absolutely afraid to be once again confined at home. No? Well, when people coming from different countries, there are a kind of flow of tourists, a very small flow, but a kind of flow of tourists coming to Madrid, especially from France, and they come, and you can see them. You can recognize them in the bars and in the terraces. They are not shouting. They are not tavern people. You know, the left people from the left in the last day of the electoral campaign said Ayuso and the Popular Party is calling for the tavern people, no, as all the population were some kind of drunk people, completely full or something. No? But people coming from abroad and also Spaniards are here enjoying, with the difficulties of the moment, but enjoying restaurant, museums, an opera house that is the only major opera house in Europe to offer full performances with, of course, all the guarantees of safety, and a kind of health and freedom at the same time. No? And for us, the learning of this situation is the choice was not, as they would have us believe, between health or economics. What do you prefer, health or economics? Because without health, there is no economy, and without economics, there is no health. The key was to understand that the two are complementary and that neither can exist without a founding principle. And the founding principle is, of course, freedom. And if I can say that, probably this is the success or the learning from our model that is also confirmed by the citizens of the region in last week's election, in which under the slogan socialism or freedom, Isabel Díaz Ayuso and people, Partido Popular, more than double our representation in the regional parliament, and we outnumber the three parties of the left as a whole, and that will allow us to continue with this freedom policy and also with new freedom ideas. No? We are going to cut taxes for the. Once again, in the last years, we have 16 years in a row cutting taxes, and we are going to do that, and opening markets, and well, letting people to do their business without the state or the region telling them, compelling them, or forbidding them to do what they know that it's the best for them.
Well, thank you. Thank you very much, Javier, for this conversation and for talking with us about what happened in Madrid. Grazie a tutti per averci seguito. Speriamo che insomma da questa chiacchierata siano emersi degli spunti su un modello, su un'esperienza, quella di Madrid, nella pandemia, di cui solo adesso si comincia, dopo queste elezioni, veramente a discutere e a parlare.